One of the major issues that we're dealing with when we're dealing with an allogeneic bone marrow transplantation patient is that it takes them a long time to rebuild a functional T-cell system. And one of the major reasons why that happens is that the organ that should be making those new T-cells is damaged. So a major effort at our center, both within the lab and in the clinic, is to come up with new strategies. How can we help patients to rebuild functional T-cells after an allogeneic bone marrow transplant? This study that we're highlighting now in this video has looked at it from a different angle. And that is that maybe there are other places within your body where you can generate T-cells. And what we found using mouse models is that there is a window, that there is a period after an allogeneic transplant that lymph nodes can function as the sites where T-cells can be generated. So one of the things, of course, that is relevant in these kind of studies is that you not only demonstrate that there is such a thing like extrathymic T-cells being generated, but also that you demonstrate that it gives you a functional repertoire, that all these T-cells really do something meaningful. So the way that we tested that is by challenging these nude mice that had undergone an allogeneic bone marrow transplantation with a virus, and we used actually several viruses. So in this way we could monitor if these nude mice were capable of generating T-cells that could fight off these viruses. And the answer was yes. So what I'm showing you here are 4 sets of images taken at different time points, day 9, 12, 14 and 16, after an allogeneic bone marrow transplant. And then you can see that there are these nice target lesions in the white mice. Those are mice that do have a thymus. And as you can see, the precursor T-cells move nicely into that thymus. On the right side, in that nude mouse, there is no thymus, so you don't see that target lesion there in the neck of these mice. But now you see that a lot of the precursor T-cells that are labeled move into the abdomen. And that is evidence that they're homing there and that those are the sites where they're actually developing into functional T-cells. This really opens up a whole new series of strategies to look at how we can boost T-cell function.